My name is Dr. David Lee Spence. I practice obstetrics and gynecology and have been doing so for the past 35 years. Since 1990, I've been practicing in Alexandria, Louisiana, providing medical and surgical care for women and delivering their babies. I truly believe that most people view an abortion to be a relatively simple, painless procedure involving little more than a physician going in with a pair of snippets and removing an indeterminate blob of tissue from the womb of a mother. This could not be further from the truth. What we are going to discuss now is a dilatation and curettage of a baby at 12 weeks gestation, commonly referred to as an abortion. If you'll look at this screen, you can actually see a well-developed baby. You can see the head, the abdomen, you can see the fully developed appendages of the baby, you see the large black area, which is the amniotic fluid, and the tissue above it, which is the placenta. If you look at this particular area, you can actually see the beating heart of the baby. You can actually see the baby moving. And once the instrument is introduced, you can actually see the baby move away from the instrument, indicating that the baby actually feels what is about to transpire. Monitoring the baby's heart rate, you can see that it escalates up to approximately 200 beats per minute, indicating that the baby is in dire distress. The baby violently moves away from the instrument in an effort to keep from being suctioned through the curettage. The soft body parts of the baby are being dismembered and retrieved through the cervix. Then an instrument has to be introduced to crush the hardened tissue of the skull in order to remove it through the small opening of the cervical canal. I want to go back to the video for a minute to point out something that is truly unsettling. What you see here in this frame is that the baby's mouth is clearly open. I have viewed thousands of sonogram images at all stages of development during my medical career, and I can tell you that this indicates that the baby is in distress. Indeed, this would be consistent with the child's evasive movements inside of the mother's womb noted earlier. This baby senses trouble and is fighting for his life. It has been my experience that when people actually see what happens to a child during an abortion, that this dramatically changes their position on the issue.